My name is Tom Maldonado. I'm a vascular surgeon. I do some work in the outpatient setting, but most of my work is in the hospital. A lot of aortic endovascular aneurysm work. And these are cases that take many hours on some occasions, have a significant sort of toll on my body physically because of the weight of the lead that I would have to wear. Of course, the radiation exposure can in some instances be on the higher side. And despite all my precautions that I would take to minimize my radiation exposure, I found myself on certain occasions with higher radiation exposure. I also had worsening back pain and neck pain from long days. Some of these cases I would do would be hybrid cases, both open and endovascular. And so especially the open part of the case with my lead on me, I would have to sometimes find myself hunched over in a position that would be many hours at times with lead on. And I just felt that my body was really aching. And at the end of the day, I was really pretty beat up. And this is what prompted me to look for another solution. The process of switching to StemRad MD was actually very seamless for me. I think that when you first look at the lead suit, it can be a little bit daunting because it has this exoskeleton, if you will, that is meant to support the lead and remove it from resting on your shoulders. That can be a little bit tricky at first, and there was a lot of good help and assistance from the folks at StemRad who fitted me for the suit. And so once that was done, it was very seamless, and I was able to really put it on and take off myself very easily. And it's been a real pleasure for me to use it every day. The only hiccup, if you will, is that it does require sort of larger gowns. So my initial experience using a StemRad MD required some adaptation as far as gowning in the operating room. There are certainly XXX gowns available, and those work well. Whether you use a XXX gown or whether you use two gowns, one in front and one in back, you can very easily adapt to that. Of course, it's a lead gown and it protects your core and your body from radiation exposure. But what's really unique about it, and what I found most appealing, was the lead shield or visor, which wraps circumferentially around the neck and head area. And also, of course, the support and the brace that lifts or supports the lead off your shoulders. So those two features, I think, were most appealing to me. I really felt that my body did not have the same fatigue at the end of the day. I found that that my posture was actually improving because I had to actually stand up straight in order to gain the benefits of the suit. And I felt just comfort knowing that my head and neck was not being exposed to the same degree. And in fact, I use dosimeter badges routinely, both inside and outside the lead suit, and I've been really proving to myself that I have a fraction of the radiation exposure that I would have otherwise. Personally, I've had tremendous technical support. If there's been a glitch or a slight problem with a certain component, they're quick to get on FaceTime. In one case, they even FedExed me a small Allen wrench screwdriver so I can tighten a certain screw. And it's this type of nuance or subtle support that I think goes a long way and makes this product unique.